Decades of research have established that dental implants are the best way to replace missing teeth. There's simply no other option that will give you longer lasting, higher functioning, better looking results. Are you a candidate for this state-of-the-art tooth replacement method? It's likely that you are. Thanks to advances in technology that have made the procedure suitable for a wide variety of situations. Let's take a look at what's required for successful treatment with dental implants. Implants are placed into the jawbone during a minor surgical procedure done at the dental office. To achieve success, there needs to be sufficient bone volume and density in the jaw to support the implants. Bone is a living tissue that rebuilds itself constantly. To do so, it needs a particular type of stimulation, which comes from the teeth. When even one tooth is lost, the bone that surrounded it begins to melt away or resorb. The longer the tooth is missing, the greater the bone loss. In the past, individuals who waited too long could not have implants because they lacked the bone volume and density to support replacement teeth. Today, bone grafting has become quite common. We don't necessarily mean the traditional method of taking bone from one part of the body and moving it to another. Most of the time, dentists use laboratory processed material that stimulates the body's own ability to regenerate bone. Grafting material is often added to an extraction site when a tooth is removed, just to make sure implants remain a viable option. There are some situations where the use of implants might have to be delayed, for example, in a child. It would be ideal to wait until growth and development has been completed, or in the case of individuals with diabetes or osteoporosis, the underlying medical conditions would need to be controlled before proceeding. Once that is accomplished, these individuals can achieve outstanding success with implant replacement teeth. The best way to determine if you are a candidate for dental implants is to schedule a consultation. Why not make an appointment today?